The Ghana Health Service has recorded 12 new cases of Lassa Fever, making the total number of recorded cases 14, with one dead. We're here at the Ghana Health Service Public Health Division to get more education on what Lassa Fever is and how we can prevent it.
The Lassa virus actually resides in a rodent. It has a name called mastomus. So the virus tends to be transmitted to human beings by way of droppings of the rodent or the urine. So what happens is that in that context, we will say that Lassa fever is actually a zoonotic condition. So it comes from an animal to man. So the typical example is like you are in your house, you cook and you leave your food, and you go and sleep. You don't cover the cooking utensils properly. So in the night, these rats will come, play with the food, eat some, and pass urine and drop things on it. The next day you come, maybe you will not even decide to hit the food, you eat it. That's the way you may have the disease. So that's the way. So it's from animal to man and man to man.
Dr. Asiedu Bakwin explains the symptoms of the fever.
So it will present like a fever. So that's why it's called Lassa fever. So the fever, you will realize that the fever is not responding to the typical anti-malarials or the antibiotics that you know. And they may have general bodily weakness, or may have what we call malaise. So that's the early stages of the infection. And then with time, you may have headache, you may be having sore throat, chest pain, and they may even have difficulty in breathing. In some instances, you may even go into coma. So we realize that our first case went through that phase.
He explains that the rising numbers should not be a cause for alarm.
The best way of managing these kind of infections is to be able to identify all contacts and kind of contain them so that they are under control over the period of the maximum incubation period. So what we are doing is that we are trying to find all persons that have been exposed, and they're going to follow them to the 21 days.
The Ghana Health Service is advising the populace to seek early treatment when they are unwell.
The crucial thing is that, you see, the outcomes depends on how early you go to a health facility. So if you have a fever, let's always not assume that it's malaria. So you go and take anti-amodiaquine and say you are fine. No, let's go to a hospital. Because it's when you go to the hospital, the doctors will think that could it be Lassa? And that's the time you pick your blood and go to the test to see what it is. So we are encouraging early reporting to a health facility.
Meanwhile, the Ghana Medical Association has advised its members to adhere to infection prevention and control protocols, especially regarding the use of PPAs at all times. This comes on the back of the infection of some doctors and other health workers contracting Lassa fever.
Indeed, among the 14 persons, we are aware that some health professionals have been infected, including doctors, some nurses, and some close contacts of these people. Yes, it's true that these people have been infected, but as we know, PPEs and protections are both the PPE dependent and then also people dependent. So we are encouraging, that's why in our message to our members, we encourage them to adhere strictly to the IPC, infection prevention and control protocols, so that they can minimize the spate of infection spread among professionals and then from professionals to other patients or community.
The Ghana Health Service would like to assure Ghanaians that they are working assiduously to contain the spread of the Lassa fever. They'd also like to remind the public to take preventive measures so that they do not fall victim to the virus. For Citi News, my name is Eno Safo.